Imagine a scenario wherein a German Shepherd dog is presented with a deep laceration on the flank with bleeding. Under this circumstance, surgical reconstruction is inevitable and urgent. One critical decision that can influence the safety of the patient and successful surgical outcome would be the anesthetic protocol selection. Remember, veterinary anesthesia is not just a technical step. It ensures the compassionate and competent veterinary care to the voiceless creature. I am Dr. S. Sendil Kumar, Professor of Surgery at Tanuvas, and in today's session, I will be talking on the essential comprehensions of canine anesthesia in the Indian context. Veterinary anesthesia is considered as an vital component of veterinary clinical practice as it improves animal welfare, surgical outcome, and the safety of the personnel involved in the surgical intervention. Veterinary anesthesia ensures superior veterinary care to our patients. Remember, precision is the tool and compassion is the purpose in veterinary anesthesia. General anesthesia is a medically induced state of unconsciousness for pain-free surgical interventions in animals. As we all know, unconsciousness is achieved with CNS depression and it carries an inherent risk. The risk associated with any anesthetic protocol in animals can definitely be minimized by thorough pre-anesthetic evaluation and assessment of the patient. Appropriate pre-medical and protocol selection, vigilant monitoring during anesthesia and recovery will ensure safe anesthetic outcome. Pre-anesthetic evaluation of patient is very important in veterinary anesthesia, and it starts with thorough clinical examination of the patient and recording the physiological parameters such as rectal temperature, heart rate, respiratory rate, conjunctival mucous membrane, and capillary refill time. The auscultation findings definitely will give a clue on the safety of the protocol to be employed in the patients. Abnormalities in these parameters such as pale and blanched mucous membrane may indicate the patient suffers anemia, and an icteric mucosa indicate hepatic damage. Prolonged capillary refill time may indicate a decreased perfusion pressure, and appropriate correction is definitely warranted before anesthetic drugs are being administered to the patient. Basic hematology and serum biochemistry involving the study of hematocrit and total protein albumin is a mandate before anesthesia. Most of the drugs are eliminated through renal system, and renal function can definitely be established with serum biochemistry. Surgical interventions on sick dogs with inappetence often suffer hypoalbuminemia, and most of the drugs are protein bound, and it may carry an additional risk if not corrected before anesthesia. Nutritional support is important in dogs undergoing anesthesia. In the Indian context, only 5 categories of anesthetic drugs are routinely used in veterinary practice. Thorough understanding of these 5 categories of drugs will ensure safe and effective anesthetic outcome. The first category goes to anticholinergics. Under anticholinergics, we have only 2 drugs. One is atropine, the second one is glycopyrrolate. Glycopyrrolate is more potent than atropine, and it is preferred for secretion control. Atropine is preferred for bradycardia management. Atropine is used at the dose rate of 20 to 40 microgram per kg body weight. The second category of drugs goes to alpha-2 agonist. Under alpha-2 agonist, we have only 2 drugs that is routinely used in India. One is xylazine, the second one is dexmedetomidine. Dexmedetomidine is more potent than xylazine, and definitely it will ensure safe anesthetic outcome. And coming on to sedatives, we have benzodiazepine group of drugs and phenothiazine tranquilizers. Under benzodiazepines, we have only 2 drugs routinely used in veterinary anesthesia. The one is diazepam, the second one is midazolam. Midazolam is more potent than diazepam and is often preferred in compromised patients. Coming on to phenothiazine tranquilizers, azithromycin is an effective drug and definitely it can be used in the anesthetic protocol. Coming on to opioid analgesic, we routinely use butorphanol and buprenorphine in the anesthetic protocol. Buprenorphine, since it has strong affinity to mu receptors, they offer extended duration of analgesia. Butorphanol has a respiratory depression ceiling effect and can safely be used in compromised patient. Apart from this, butorphanol has an antiemetic property that will be routinely used in small animal practice. And induction agents are used to induce anesthesia and to do intubation. Multimodal and balanced approach in veterinary anesthesia involves combining different drugs, achieving effective anesthesia, minimizing the side effects of these potent agents. There are 3 drugs which are routinely used for induction of anesthesia in canine practice. The first one is ketamine, the second one is propofol, and the third one is etomidate. Ketamine causes CV stimulation and it allows intubation, and propofol has extrahepatic site of metabolism and can safely be used in compromised patients. And the third category of drug is etomidate. Etomidate is suitable for cardiac patient. The limitation associated with etomidate is muscle contraction. So this can be effectively counteracted by combining it with a benzodiazepine. After successful induction of anesthesia and intubation, the anesthetic maintenance can be done with inhalant agent such as isoflurane or sevoflurane in dogs. Inhalant maintenance is the preferred protocol since these agents do not require tissue metabolism and is a safe protocol. When there are resource limitation, propofol can be used as a CRI to maintain anesthesia in dogs. During anesthesia, the vital signs such as temperature, heart rate, respiratory rate, pulse oximetry, ECG and ventilation assessment through end-tidal carbon dioxide measurement will give a valuable information on the patient and will ensure safe anesthetic outcome. The drugs whatever we have discussed can cause thermoregulatory influence and can end up with hypo or hyperthermia. So monitoring the temperature along with these vital parameters will ensure safe anesthetic outcome. During anesthesia, we encounter 2 common complications. One is hypoventilation, the second one is bradycardia. These 2 complications can be very easily managed. The hypoventilation during anesthesia can be managed by oxygen supplementation as well as with assisted ventilation. Bradycardia management can be effectively done with atropine. And during anesthesia, if fluid requirement is required, definitely fluid therapy can counteract the hypotension associated with anesthetic protocol. Oxygen supplementation, assisted ventilation, bradycardia management through atropine will eliminate all the common complications that are routinely encountered in dogs. Anesthetic recovery is a crucial part of anesthesia and it definitely influences the successful outcome. Patient undergoing anesthesia may suffer hypothermia in the post-anesthetic period. Thermal support and oxygen supplementation are the 2 basic things that has to be done to avoid anesthetic related complications. And remember, most of the inhalants whatever we use in the routine practice do not have residual analgesia, and pain management has to be given the topmost priority, and if the animal suffers pain, appropriate pain management protocol or opioid supplementation is a mandate in the post-anesthetic period. Hypoproteinemia and hypoalbuminemia are the common sequelae in sick patients. When a sick patient is subjected to anesthesia or surgical intervention, these 2 parameters has to be corrected. Hypoalbuminemia and hypoproteinemia can be corrected easily by nutritional support with a commercially available diet so that it can meet the protein requirement and it can avoid anesthetic related complications. nutritional status of the patient undergoing anesthesia and surgical intervention will definitely influence the outcome. Good quality protein, polyphenols in the nutrition will definitely improve the outcome. Godrej Ninja has high quality protein and polyphenols. This can help for a healthy lifestyle in pets. Anesthesia is not just a tool or protocol. It is a promise of safety and responsibility. Anesthetic excellence transforms life. Let us make every veterinary procedures pain-free, safe and comfortable for our voiceless patient.